What are the different types of mental health professionals, and who should I or my loved one go see? I hope to give you a thorough answer to that question by the end of this video, that you have some sense of what type of mental health professional will be able to best address your needs. Let's get into it. Welcome back to the ACS Mental Health Counseling YouTube channel. My name is Adam Schwartz, and I'm a licensed mental health counselor in New York. I specialize in anxiety disorders, men's issues, and relationship coaching. Please like, comment, and share if you find value in this video. So, you've decided to possibly pursue mental health services for yourself or to help a loved one find mental health services to address an issue that they might be having. You've probably already noticed that there is an absolutely dizzying array of various professional types with an even more dizzying array of alphabet soup following their names. It can be frustrating. I hope to give you a succinct yet comprehensive outline of the different types of mental health professionals and a kind of taxonomy or organizing system of care. Picture a tree of life that organizes all of the creatures on the planet and how they're interrelated. We're going to construct the same thing for the mental health ecosystem. Stick with me. It'll get a little bit complicated, but just remember, I had nothing to do with this system's inception or creation. I'm just the messenger. So, first thing to understand is that the letters or credentials following a clinician's name specifies what kind of academic program they completed, which led to their current license type, which in turn more or less specifies what space they occupy in the mental health panoply of clinicians. Keep in mind, almost nothing that I say will be an absolute. Think of these more as rules of thumb or heuristics. There will be exceptions, as life is replete with nuance and aberration. Haven't you noticed? I certainly have. So the first large branching division that I want you to conceptualize in our mental health taxonomy is this. Are you interested in medication for your issue, or are you interested in therapy for your issue? Medication, therapy. If you're interested in medication, then you'll be pursuing services with someone with prescribing privileges in your state. In most cases, you might just start with your primary care provider, many of whom will write psychiatric prescriptions if they feel it's appropriate, of course, and are fully empowered to do so. Or if you want a more specialized perspective, a psychiatrist, which is to say an MD or a DO that completed specialized training in psychiatry, might be a better option. Some PCPs specifically will not write psychiatric prescriptions, as they'd prefer you go see a specialist, and to my way of thinking, this is perfectly understandable and admirably cautious. I like it. If you can't work directly with a psychiatrist, which is likely these days due to demand, you might find yourself working with a nurse practitioner, an NP, or a physician's assistant, a PA, being supervised by a psychiatrist. These are what we call physician extenders because they increase access to needed care. They will also have specialized training in psychiatry, assuming they are working under a psychiatrist, and even if they're not, I believe they're still trained by a psychiatrist at some point. Now, further complicating the matter, for some medications, usually ADHD medications of certain sorts, the prescriber might want you to see someone with special training in assessment and diagnostics. So enter the clinical psychology PhD or the psychology doctorate, the PsyDoc. For our purposes, these two degree types are more or less synonymous, although they do have a slightly different professional emphasis. While both these degree types can and do engage in psychotherapy, they have a particular expertise in diagnostics and assessment and spend a lot of time doing that. In most states, 45 states to be exact, so in all likelihood in your state, psychologists cannot prescribe medication, and so you'll need to take your assessment back to a prescriber following this process. So it's a little bit of back and forth. So to sum up on the I'm seeking medication side of our taxonomy or organizing system, under this branch we have psychiatrists and PhD psychologists and PsyDocs at the highest level. Psychiatrists are medical doctors who actually prescribe medications and supervise PAs and NPs below them who also prescribe medications. Psychologists are the assessment and diagnostic specialists who might be the gatekeepers you need to pass by in order to get the prescriber to prescribe certain more restricted medications. So let's shift over now to the I'm interested in therapy side of things. All of the professionals we've already discussed can do therapy, both psychiatrists and clinical psychologists, but it's rather rare for psychiatrists these days, and there are rather few overall clinical psychologists doing therapy when you compare them to all the master's level clinicians who are doing the vast amount of psychotherapy at any given moment. You can think of clinical PhD level psychologists, as well as psychiatrists, as being at the top of this hierarchy as well, as they are the highest level credential that might engage in psychotherapy. Now, interestingly, most people don't know this, the majority of PhD level psychologists, about 60%, are researchers and academics and aren't trained to do any clinical work. So the key word here is clinical. Clinical psychologists do therapy. All other psychologists do things like research how the eye works, or decision making, or personality models, and might not have the first clue how to help you with your anxiety or your marriage. So in all likelihood, you're going to find yourself working with the master's level clinicians in the branches below these, and there's nothing wrong with this. Therapy is a very specialized, rather perishable skill set, and it can be wise to do therapy with someone who is actually doing therapy day in and day out. Bottom line is this: don't worry too much about the clinician having a doctorate or not. Often, master's level clinicians are actually doing more therapy and hence a little more in practice. So we are talking about here mental health counselors, LMHCs when fully credentialed, clinical social workers, LCSWs when fully credentialed, marriage and family counselors, LMFTs when fully credentialed. Now keep in mind, there might be some variation from state to state on these credentials. For instance, I'm an LMHC in New York, but some other states would call me an LPC, or licensed professional counselor. All of these degree types are fully licensed to provide the service of psychotherapy in the state in which they are licensed, but also have some slight differences in their respective focus. That's what we're going to get into next. LMHCs are clearly the superior clinical ninjas that can lay waste to any personal concern or individual pathology that is placed in their path. I'm kidding, and I'm clearly a bit biased as this is my degree type, and I'm pretty proud of it. But I'm only half kidding, because LMHC programs do focus almost exclusively on individual clinical concerns. So LMHCs are a great option. And don't worry about the, I don't want to see a counselor, I want to see a therapist thing. The terms are synonymous in this instance. Counselors are just a subtype of psychotherapist. So next would be social workers. Clinical social workers are social work program graduates that went on to focus and earn an additional clinical credential, and they are a great option for psychotherapy. Their initial training is much more heavily laden with patient advocacy and an understanding of the social safety net programs that we have in place at both the state and federal level. So in addition to their clinical skills, they can be a wonderful resource for garnering you more resources and access to programs that might help with the pragmatics of poverty, persistent mental health problems, substance abuse issues. Next will be licensed marriage and family counselors. As the name immediately implies, these are your specialists in family and relationship dynamics. You have a problem with your significant other, or you're really struggling with your relationship with your teenager, or are looking to process some things as an adult with your family of origin. This degree type specializes in these matters. LMHCs and social workers are fully empowered to do this work, and many even come to specialize in the family dynamic stuff. But with an LMFT, you know that this individual intentionally went into their graduate program wanting to focus on family dynamics. And to my way of thinking, this probably gives them a leg up. Now, a couple caveats here. If you're seeking out services for a child, then any of the degree types we've discussed to this point are a good option. But you definitely, in my humble opinion, want a clinician that specializes in working with children, and probably a clinician that specializes in play therapy. I, for instance, have next to no experience with children and would not be a great option, as applying a clinical skill set to the issues of a child is very different than applying a clinical skill set to the issues of an adult. If the prospective client is a teenager, then the adult skill set is much more transferable and the specialization is probably less important. You just simplify the language a bit and change some of the explanatory metaphors. If we are talking about a very young child, think about 2 years to 6 years, or an individual with developmental disorders or delays, then you will want to pursue specifically, perhaps, someone trained in applied behavioral analysis. So an ABA credential is what you'd look for. So, you still with me? I warned you that this would become kind of tortuous. If you are, fantastic. You have an admirable attention span. If you aren't, no problem. That's the beauty of being able to stream content. You can always go back and review. So, final credential type before we recap on this side of our clinical taxonomy. Substance abuse specialists. In New York, we call them CASACs, which stands for something. Funnily enough, I had gone through my entire career to this point thinking that CASAC, C-A-S-A-C, stood for Chemical and Substance Abuse Counselor, and only learned in researching this video that it actually stands for Credentialed Alcoholism and Substance Abuse Counselor. So we are all learning all the time in the best of all possible worlds. The interesting thing about this credential is you don't need a degree beyond a high school diploma or a GED. You need to complete supervised clinical work and pass an exam like any other credential, and many, though of course not all, CASACs actually get into the field because they had their own past struggles with substance abuse. This personal experience is widely thought to provide some very useful firsthand insights into dealing with substance abuse issues, which might be beneficial to many clients. The idea being that there are some things that can't be learned, or at least not fully learned from a book. And as someone with his own history of alcoholism and has been in recovery for 15 years now, I tend to think that this is correct. So CASACs are a great option for substance abuse issues, but any of the clinician types we have discussed so far can, of course, do this work as well, and they're fully empowered to do so. This probably covers about 95% of the landscape. There are some aberrations, like people who got master's degrees in psychology and then went on to get an LMHC license, which happens occasionally, or life coaches, which is a somewhat specified and varied field from state to state and is mostly an unlicensed profession, though these folks can be very helpful for many things. But if I get too deep into the weeds surrounding our metaphoric tree, then I'll likely just begin to confuse and frustrate you. So, to recap this monstrous amount of information in this initially humble video, here's you about to proceed and explore the different branches of our mental health taxonomy. First thing to consider is, are you looking for medication or are you looking for therapy? If you are looking for medication, then ideally you will be seeking out psychiatric services with a psychiatrist or a physician extender working below a psychiatrist, like an NP or a PA. But you might have to go see a psychologist first in order to get a well-validated diagnosis, depending on what type of medication you are seeking. On the other side of things, you might work with a clinical psychologist, but will more likely work with a master's level clinician who is either an LMHC or an LCSW or an LMFT. LMHCs and LCSWs are particularly good for individual concerns, and LMFTs are particularly good for family and relationship concerns. If you're seeking services for a child, make sure that the clinician specializes in the concerns and interventions of childhood, like play therapy or applied behavioral analysis. If you need help with substance abuse, then a CASAC is a wonderful option and might have useful first-hand personal experience with addiction. More than anything, remember that these are rules of thumb, and many different types of clinicians can and do address a wide variety of issues. I do hope, though, you have a little better sense of what all those letters after people's names actually mean, and a slightly better sense of who is likely to be the right clinician for your particular concern. Okay, all the best. Thank you for joining me for this video. I will see you in the next one. If you enjoyed the video or found it informative, I would humbly request that you hit the like button. It helps me in the algorithm, and it helps me get this information out there. Take care.